In this lesson, we'll take a look at the great vessels, the coronary circulation, and the conduction system in the Brown heart model. So before we begin, notice a few of the blood vessels or some of the blood vessels are painted blue. That tells us that that blood vessel has deoxygenated blood. What that means is low levels of oxygen and higher levels of carbon dioxide. The blood vessel that is painted red is just the opposite. This has high levels of oxygen and low levels of carbon dioxide. As a general rule, the blood vessels that have the deoxygenated blood, they're going to be bringing the blood to the lungs for oxygenation, and the red blood vessels are going to be bringing the blood to the body cells for oxygenation so that they get their nutrients and their oxygen. So let's take a look at some of these great vessels, right? They're located here at the base of the heart. So I'm not too concerned about these two right here. I'm going to do this in a separate lesson, but these are the two brachiocephalic veins. We have a left and a right one. They unite to form, this one I do want you to know, the superior vena cava, right? So this is going to dump deoxygenated blood into the right atrium. From the right ventricle, deoxygenated blood is going to be sent this way into the pulmonary trunk. So this is deoxygenated blood that's going to head to the lungs. Now, anytime you see the word trunk right here, that means the blood vessel is going to split. So you'll see right here, there's a split. We don't see the two blood vessels that are splitting from the trunk, but we see one of the two. This is the left pulmonary artery, and this is going to bring the deoxygenated blood to the left lung. We don't see the right one, but the right one will be heading this way under these blood vessels to the right lung. Now, once the oxygenated blood returns to the left side of the heart and ultimately makes its way to the left ventricle, the left ventricle is going to contract and push the blood into now the aorta. That's this red blood vessel right here. We're going to divide the aorta into three parts. Right now, we're seeing two out of the three. This first part that goes up and down right there is the ascending aorta. All right, that's directly connected to the left ventricle. And then here's the arch of the aorta right here. If we turn the heart around, we do see some of the great vessels here. So let's take a look at the blue ones first. So this here is the right pulmonary artery bringing the deoxygenated blood to the right lung. So that would be heading over this way to the right lung. And then this is the left pulmonary artery going to the left lung. These were the two blood vessels that came from the pulmonary trunk. These 1, 2, 3, 4 are the pulmonary veins that are going to return the oxygenated blood to the left atrium. Right, so these two are coming from the right lung. These are the right pulmonary veins. These are the left pulmonary veins. Right, and they ultimately end up in the left atrium. Here's the inferior vena cava. Here we're getting a good view of this. Look how big this is. The diameter of this blood vessel is so wide. This is going to bring blood up into the right atrium from below, right? It's going to bring blood from your legs and your torso, and that's bringing that up into the right atrium. So that's going to be your inferior vena cava. So let's take a look now. So that what we just did was the great vessels. Let's take a look now at the coronary circulation. This is the blood that is going to feed the heart and drain the heart muscle of used blood. So we're going to call this the coronary circulation. Let's start with the coronary arteries. So here's a good view of the left ventricle, sending blood up through the aortic valve here, and now entering the ascending aorta. The first blood vessels to come off of the aorta are the two coronary arteries. Here's your left coronary artery, right coronary artery. Let's follow them now. The left coronary artery, here it comes, right here. So it came out here. Now we're seeing it on the outside right there. All right, that's where it came from the aorta. The left coronary artery has two branches that I'd like you to know. Right here, you see it split. So this is going to be the circumflex artery, right there. And then this big one right here is the left anterior descending. And that's what I put over here, the LAD. That's what we call it in medicine a lot. They just abbreviate the LAD. Or if you like, you can call it the anterior interventricular artery because it's going down between the ventricles and it's in the anterior interventricular sulcus. However you like, either or is correct. This one's an important artery because it's supplying most of the left ventricle and part of the right ventricle. If this blood vessel were to become clogged, like blocked, with a clot, or atherosclerosis, right, a fatty deposit, it could cause this part of the heart not to get blood, and this heart muscle dies, and it can be fatal. Years ago, they used to call the LAD the widow maker. Historically, men got heart attacks more than females, so if they got a blockage here and it caused massive, destruction to the heart muscle, a lot of times it would be fatal. Okay, so left coronary artery, then it splits. The two branches I want you to know are the circumflex and the LAD. Now, the right coronary artery, if I go back a slide, came out right here. So this one's going to go to the right, so we could see it coming off like right there. This is the right coronary artery. And this also has two branches that I'd like you to know. You'll see the split right here. So this right here in the front, it's going to go along the edge of the right ventricle. This is called the marginal artery. All right, so that's this branch here. Then the right coronary artery goes around the back of the heart. Let's follow it. And it comes around right here. And it's going to terminate as the second branch, the posterior interventricular artery. Right? This is actually sitting in the posterior interventricular sulcus. Okay, so again, left coronary artery, two branches you need to know, circumflex and the LAD. The right coronary artery, two branches, the marginal artery, we see that in the front going along the edge over here, and then we turn the heart around and it terminates as the posterior interventricular artery. Okay, so all those arteries that we just did bring blood to the heart muscle so the heart muscle can contract and beat at a regular, at a regular pace. Once the heart muscle uses that blood, it's going to put the blood in the veins, and the veins are going to bring the blood back so that it can become reoxygenated. So when we look at the front of the heart, I want you to remember three letters: G, A, S. We're going to look at these blood vessels from the left to the right. This big guy right here, all of this and this is the great cardiac vein. That's going to be our G. Then these two here are the anterior cardiac veins. And then over here, this little guy on the side is the S. That's the small cardiac vein. So all the blood now is going to be going this way. Right? This way, the veins are bringing the blood back to the heart. Oh, that blood is going to go this way. Okay? G, A, S. Great cardiac vein, anterior cardiac vein, small cardiac vein. On the back of the heart, there are also three veins, but this time I want you to remember PMS. Again, we're going to read the vessels from the left to the right. P, M, and I'm going to use the small cardiac vein again. We're using that one twice. P, M, S. This vein right here, right, the blood would be coming back this way, is the posterior cardiac vein, and the blood's going to drain into here. This is the middle cardiac vein, and the blood's going to drain into here. And then the small cardiac vein is going to go this way. So in the front, you're going to remember G, A, S right there. In the back, you're going to remember P, M, S. All these veins, whether they're in the front and the back, for the most part, I have an exception to that, but we're not going to get into it here. all drain the blood into the coronary sinus, this big vein back over here. This is the one I was telling you about earlier that you use this as your reference point for looking at the back, right? So this is the coronary sinus. All the blood in these veins are going to drain into here. And now you can see this coronary sinus. Look what it's doing. It's draining blood into the right atrium. If you remember when we did the right atrium, I said to you there's three blood vessels draining blood into the right atrium, the two vena cava, and ready? This one right here. And here we could see the blood now going into the right atrium, and then eventually it'll get sent to the lungs. Okay, so those are the veins of the coronary circulation. The last thing I want to do in this lesson is just take a look at the conduction system. In order for the heart to beat efficiently, the atria have to beat first, then the ventricles will fill as the atria are contracting. Then the ventricles contract second, and the atria are filling. And then as the ventricles contract, they're going to push the blood up into the great vessels. So we need to coordinate that heartbeat. Well, what I'm about to show you is the conduction system. This is what coordinates the heartbeat. It starts up here. This green tissue right here is the sinoatrial node, right? We call it the SA node. This sets the heart rate, right? If your heart beats at 72 times a minute, this is where that 72 beats a minute comes from. From there, the next node is the atrioventricular node, and then that's going to lead to the atrioventricular bundle right there. We used to call it the bundle of His. Then the AV bundle splits into a left bundle branch, and that's going to lead to the Purkinje fibers out here. And then the right bundle branch comes down this way and it leads to the Purkinje fibers on the right. The Purkinje fibers actually touch the cardiac muscle and stimulate them to contract from the bottom up, right? So the heartbeat's going to go this way. The contraction of the ventricles are going to go up this way. The last thing I talked about on the first video, from the right bundle branch right here, there's a branch that comes over. This is the moderator band, right? We had said in the previous lesson that the moderator band is only on the right side of the heart. Okay, we don't see that on the left. Right, so this is the left bundle branch. This is going to bring the electrical impulse to the right side, I'm sorry, to the left side of the heart. Here's the right bundle branch, bringing the impulse to the right side of the heart. And again, that moderator band is actually going to these papillary muscles so that they contract. And the ultimate goal of the conduction system is to get the blood in the atria to flow down like that, and then the ventricles to the blood to flow up. Right? We want to push the blood up into the great vessels. Okay, so that concludes this lesson of the great vessels of the heart, the coronary circulation, and also the conduction system.